Ladies and gentlemen, please follow me on 5 points to better health and how to avoid serious loss. The first point I'd like to make for you is that health care is not medical care. My friend here, Salvatore Frascinella, a New York executive at 65 years of age, had a serious problem. His 3 cardiologists thought he was too risky for bypass surgery, and they had him taking a dozen pills a day, but he was getting worse. He couldn't walk 2 blocks without severe chest pain, and what did the future hold for him? Not much. But he came to a health program and was able to get off all of his medicine. He discussed it with one of his cardiologists who said, if you quit the medicine, you'll die. But what happened proves that health care is stronger than drug care, okay? Because he got off all his medicine and lived another 30 years. So medical care is not the best answer to our health problems. And the reason it's not health care is because adverse drug reactions make medical care a leading cause of death. I have here serious adverse drug reactions from the Archives of Internal Medicine in the year 2007, September issue. It was reporting how that over a 7-year period from 1998 to 2005, the deaths from adverse drug reactions increased 2.7-fold. Question, how many were there before in 2000? I'm sorry, it was 1998. It was tax day, April 15, that JAMA, Journal of American Medical Association, reported 106,000 deaths in hospitals from adverse drug reactions. Well, what is an adverse drug reaction? It's not an overdose. It's not a wrong prescription. It is just a right prescription taken the right way, but the people died somehow, surprised, didn't expect it, bad reaction. Okay, that's what it is. And there's no way to predict these usually. The point is that if you multiply 106,000 times 2.7, you have medical care as the 3rd leading cause of death. But if you factor in one more report, June of the Western Journal of Medicine in 2000, the year 2000, it says that there was 199,000 outside the hospital. JAMA was in hospitals. The Western Journal was reporting outside the hospitals, 199,000. Add them together, it's 305. And if you multiply that times 2.7, medical care as of 2005 was a leading cause of death. And since then, we've had 2 more 7-year periods. If you multiply 2.7 for each of those additional 7-year periods, hey, we got a 9/11 going daily. 2 of them, 2 9/11s daily. 6,000 people approximately are dying daily. Well, you know, you don't know that many people in this country, and you might only know one person in a year that dies from medical care. And so it's just, well, the doctors did the best they could, you think, okay? Well, not always, and I just say, if it's somebody you know and love, hey, it's a sad loss. We're going on now to health care. Real health care is seen by this, this is Breslow's study at UCLA, a 10-year study, found 7 simple health habits good for a 30-year difference between the absolute extremes, those that broke all the rules, like smoking, drinking, obesity, also, by the way, lack of exercise, lack of sleep, lack of water drinking, preference for the substitutes for water with sugar, caffeine, etc. These things are not good for health, and let's just, if we factor all this in, we can do better. We can live longer. And Breslow's study did not even look at the specific foods, okay? But if you include specific foods, you can reverse heart disease. I'm going to be showing you just a little later a DVD, a couple segments of it. Bill Clinton's cardiologist from the Cleveland Clinic, Dr. Esselstyn, wrote the book on prevent and reverse heart disease. Yes, you can do it. This U.S. News report is about Dr. Ornish from California, cardiologist. I've had these experiences, as I said before, with Salvatore from New York. People can reverse their condition because the body is designed for self-healing. Cuts, burns, bruises, broken bones heal. So will cancer even be reversed in some cases. Diabetes, definitely. We're going to tell you about this later, but right now I just want to tell you how we live is also how we die. Our destiny, which way are we headed? Are we really wanting to live and end like Miriam Iwawaki was going in a nursing home and she begged us to take her because she was drugged up. In nursing homes, the average number of prescriptions is 9 to 11, and that was years ago. It's probably more now, but she was taking a dozen pills a day for her diabetes and her nerves and her sleep and pain, etc. This is not the way to go. These people can stand in the hallway and fill their diaper and think everything's okay. Not good in the mind, no brain, no pain, etc. But bottom line, we want to live like I think Dr. Ken Cooper, who wrote the book Aerobics. He tells of his mother who went out for a jog on Friday afternoon. She was in her 90s, didn't feel well on the weekend, and on Monday she died. Well, no need of custodial nursing homes or halfway houses. We call it assisted living, where they help you take the pills and so on. I don't need that kind of help. I'm 77 and in great health, and I don't plan to go the medical care route. And because I've seen it from the inside. I've seen how smokers, for example, I took my internal medicine at the University of Arizona, and these men would sit around breathing oxygen through a tube the last months of their lives. Not good. We had a stop smoking program, and more than 100 out of 150 quit. And think of that for your corporation. If every smoker quit, how much you would save. This last fact that I show you here from medical literature, recent news, shows that many medical bills now are over $1 million. I have a friend that when she goes into the hospital for a week, it's $100,000. Not good. We don't need that. That's not health care. That's disease care, and we can help the health if we know how to prevent. The body will do so. And so just want to encourage you to think serious about learning more. And if you're looking corporately for a speaker, there's more information on how to quit smoking and major bad habits. There is one that is the most common cause of symptoms for which people see a doctor, and we're missing it. We don't see it. So I'd like to tell you about it and how to eat better. I had an executive, when I did executive health care, who said that sugar bothers joints. Another one told me cheese bothers joints. A third one said meat bothers joints. These were smart men who had figured it out. But when I had headaches, I couldn't see a relationship to the diet. I even went across the campus to a medical center where the man who teaches medical students neurology said, I asked him, could anything I eat or drink be the cause of my headaches? He said that would be very rare. I later learned he didn't know what he was talking about, and I'd like to explain it to you in the program we're going to share at your company. God bless you. Look forward to hearing from you.